Was there a question over here?
I just had my hand up. I just couldn't help when you asked a question about abortion, but think of Nancy Pelosi's words, and I guess Anne Garden when she was on George Stephanopoulos' program right after the stimulus came out, and there was funding for family planning in the stimulus. And even George Stephanopoulos said family planning in the stimulus, and she said when the government is providing health care, they absolutely have an interest in reducing the number of people who are going to be taking advantage of that system. So I think absolutely it's a no-brainer. It's just a question of to what degree and when. And I just wanted to thank Rick, too. I'm with Eagle Forum, which is largely a women's organization, but one of the things that I find so frustrating, there are so many aspects of this debate that get so politicized. But thank you for standing up for Katie. Unfortunately, it's too late for her, but thank you for standing up for all the American, young American women and men. But I just think it's so interesting that the feminists indicate that they are the advocates of women's health, and yet where are they in this debate? As long as they get their abortion, they're fine. But where are they fighting for all the women who will be contracting breast cancer, and for whom it's going to be too late, and cervical cancer to speak? So thank you.
Well, I'll tell you, you go over there and meet these individuals, and you're just heart breaks because their government killed them. Their government made these decisions that killed them. Because if they had never done anything, Katie would have gotten a pap smear completely on her own. But because it's all done through the government, there's no option to get it. So it's horrible. You just can't imagine that our government would want to do this. Why would you as a politician want to be responsible to make these decisions on somebody's life? They have government mandated wait lists. And then you can see, if you just look at the stories, here's some just recent stories. NHS doctors bullied into silence over dangerous practices. That's exactly what happened. Our doctors won't be able to talk because if they're outside the system, the government will say, "Oh, you can't say a word, or we won't pay you anymore." Guidance on the use of a drug for macular degeneration can't be used for everything, and things like that. Then some patients that were sicker were not taken care of. They wouldn't take care of patients who were less sick because they could meet some government mandate. And there's story after story after story. So I can't believe that Americans aren't saying we need to really learn about the UK system and the Canadian system before we go down that path.
And there's no accountability, ever. I was involved with war on poverty back in the early 70s, and I thought public housing was the dumbest idea that ever came up. I mean, who came up with the idea of taking 20,000 of Chicago's poorest, least functional families, cramming them all into a high-rise building called Cabrini Green, and this could possibly be good for anybody? I mean, who was that person? and why is that person not held to account for the thousands of lives and families that were destroyed because of these dumb ideas? There's never accountability when government's involved.
I just want to build on also this. I do agree that what Rick's done is great to put a human face on these stories. I will though stress also that we do have a socialized healthcare system in America. It's called the Medicaid program. And you could probably find dozens of people who would have similar stories on the videos as well. So we have one within our own country that we shouldn't be building on and shouldn't be ignoring that it's a problem for the people who are on it today.
Any other questions? Well, I want to thank these three expert panelists for coming here today and sharing the time with us. I think that their presentations were amazing. Thank you very much.